Namaskar. Good evening. I am your host Avni Katakkar, yet again with one more episode of Conversations Unplugged, brought to you by Story Scrapers. So today we are going to dive into a topic that is still a stigma, but it is very essential to a woman's well-being. And to discuss that, we are honored to have with us Dr. Denisha Kiklawala. She is a dedicated obstetrician, gynecologist, and prenatal care specialist. So, without wasting any time, just grab your cup of tea and let us all discuss the very important topic about periods, menstrual hygiene, and menstrual health. Shall we all welcome Dr. Danisha Kiklawala? Here she is. Yeah. Hello, doctor.
Hello, how are you?
I am very good, and thank you so much on behalf of Team Story Scrappers for taking out time for us because today, being a menstrual hygiene day, having an expertise talk with you means a lot to us and our audience.
Thank you so much for such a lovely introduction. I am looking forward to this session. Thank you. I am working right now in Niva Hospital, Umargaon, as a gynecologist, and I have done my post graduation from Masina Hospital,
Yeah.
which is in Mumbai. I even did I did 1 year posting in CHC Umargaon. So right now I'm here. And before starting the session, I would like to say that today is Menstrual Hygiene Day. So it is very important for all the females to take personal care for her personal hygiene and the surroundings.
So true. Yeah, because menstrual hygiene is very like it is a topic that's very basic, yet it is just undiscussed. People don't want to talk
Yes,
about periods, and I don't know why. And I guess when we were discussing about going through this live, Dr. Denisha, so she's also working in a rural area, which means a lot because we were discussing that women in the rural area are so hesitant even visiting a gynecologist,
yes, true.
discussing their menstrual cycle and this basic things. So she has a very appropriate expertise in this field. And there she came with a question, like we all had the question, but we didn't know how to put it properly. And she told me, do we need to answer this? And yeah, the question was, why is menstrual hygiene so important? What is exactly
Yes,
menstrual hygiene?
yes. So menstrual hygiene, if you don't take care of it, then there are chances of reproductive tract infection, then you may have urinary tract infection. So most of the hygienic products which we are using right now contains chemical. So there can be chemical reaction and it may lead to other diseases. There is one severe condition which is called as toxic shock syndrome. Why does it happen? Prolonged use of pads without changing it can lead to toxic shock syndrome because in which streptococcus infection may grow and it is like you'll have fever, you'll have rashes or vomiting, and it may lead to multi-organ failure. It is that
Oh,
severe. We don't know about all these things. Then
exactly.
repeated cervical infection may lead to cervical cancer. So all these things we have to take care of our personal hygiene. It is very important. Normally in day-to-day life we ignore it and then we face all these problems. That's why personal hygiene is very important. Menstrual hygiene is very important.
Yeah, because I think अभी like if we talk about it in हिंदी, जो हम कह रहे हैं कि औरतें जागरूक हो रही है regarding their
Hmm.
period talks अभी हो रहा है, but before quite some time, uh, women were not even ready to talk about periods to their daughters as well.
Yes. Yes,
तो
true.
ये,
It is very
या
important.
तो हाँ, तो इसीलिए मुझे ऐसा लगता है कि स्टिल देयर इज अ लॉट ऑफ अनअवेयरनेस अराउंड, जैसे अभी आपने ये सारे बताए कि ये चीजें हो सकती है अगर हम बेसिक हाइजीन पीरियड्स के वक्त ना रखें तो। आई एज ए वुमेन आई एम 35 एंड आई वाज नॉट नोइंग अबाउट दिस। हमें
True.
एक वेगली पता होता है कि बाबा अगर हमने हाइजीन नहीं मेंटेन किया तो वी माइट गेट सम इन्फेक्शंस, बट व्हाट काइंड ऑफ इन्फेक्शंस, व्हाट आर द repercussions that, like, doctors like you could probably let us know.
Yes, true.
Yeah. So,
Uh,
doctor, yeah, please go ahead.
no, no. What were you asking?
Yeah, I was just saying कि ये जो you said कि हमने pads regularly change करने चाहिए, तो this just what to say, एक ऐसा question मन में आया कि आजकल, because I tried it and I had a bad experience recently. I tried tampons over pads because I had infections because of pads. So I tried tampons on recommendation of my friends, but it
Hmm.
went really bad with a urinary tract infection. So what
Okay.
do you suggest in this case? आपके क्या, like, personally or as a doctor, what would you suggest us?
See, choosing between tampon pads or a menstrual cup is your, personal choice. First thing, if you use pads, then you have to change it regularly. Secondly, try to use cotton pads.
Hmm.
There are a lot of, there is like Whisper is there, Stay Free is there. There are a lot of pads over there, but you have one pattern, like it's a cotton pad, so use that if you're using it.
Hmm.
So a lot of females won't get infection if you use that pad. And secondly, menstrual cup is also a good option on tampon.
Okay.
Menstrual cup, tampons is something which you have to change every 4 to 5 hours. So what suits you is like, you will know better than me what is more appropriate for you, whether it is pad, whether it is tampon, or whether it is menstrual cup, and what you are comfortable with. Because
Hmm.
everyone is not comfortable with menstrual cups or tampons. A
Yeah.
lot of females right now is comfortable, they are more comfortable with pads.
Hmm. Hmm.
अभी तो फिर भी पेरीफेरी में तो still they use, that cloth.
Cloth.
You
Yeah.
must be knowing,
Right.
yes, cloth they use, and then they'll,
Huh.
reuse it.
Hmm.
But
Hmm.
that I don't suggest. But pads are better. But then it is like individual choice what they want to have.
Thank you so much. Thank you for just answering my random question. Thanks a lot.
Okay.
And with that comes a question that, what is considered as a normal menstrual cycle, and when should one be actually what to say concerned about कि नहीं मेरी menstrual cycle wrong, गलत चल रहा है कुछ.
See, normally menstrual cycle generally occurs every 21 to 35 days. Okay, and
Hmm.
the female bleeds for around 3 to 8 days.
Okay.
Now, the volume of the blood loss may vary, but it is usually around 30 to 50 ml of blood loss every month. So, this is a broad, whatever I said is a broad definition of menstrual cycle, but it
Hmm.
may vary to person to person. Like, agar if one female is coming to me and she is saying that, ma'am, I have like regular period, but I bleed only for 3 days. Is it normal? Yes, it is. And if some other female comes to me and tells me that I bleed for like 8 days,
Hmm.
so is it normal? It is normal. If she is having her periods like 8 days from the start, from the day she started her menses, then it's
Hmm.
regular. It's regular. Then it's normal. But what is not
Okay.
normal? When you are having intermenstrual bleeding. Intermenstrual bleeding means you are having regular cycles of like 28, 30 days, but you are having spotting in between your periods. Like on
Yeah.
14th day, 10th day of your period, you are having spotting. then this is not normal. Or if you are having delayed periods, like every 2 to 3 months you are getting periods, it is irregular, then it is not normal. Or the
Hmm.
frequency of your periods are more, like every 10 to 15 days you
Hmm.
are getting pe- periods, then this is not normal. You have to consult a doctor for that, because something, if intermenstrual bleeding is there, or if you're bleeding more, or if once your bleeding start it doesn't stop, all these things are there, then something is wrong. So you have to evaluate yourself why
Hmm.
this is happening to
Right. Thank you once again.
you.
And now there's something, a question that I have, many women out there have. My nieces have the same question. And that's कि when I was young, मुझे first time period आया था. I was for many years I was told कि when you grow up periods के cramps रुक जाते हैं, वो pain कम
Hmm,
हो जाएगा with time, with your age that pain will mellow down. Same
hmm,
was told to my nieces. Now I am in my mid 30s and I still have my period cramps. Okay.
hmm.
So the question is, can you just explain what causes this menstrual cramps and how to manage them at any age? Because हमें तो पहले यही बोला गया था कि बाबा एज के साथ menstrual cramps कम हो जाते हैं, जो मेरे साथ तो नहीं हुआ.
So so uh, cramps during menstruation or pain during menstruation is, first of
Yeah.
all, it is called as dysmenorrhea. Okay,
Okay.
so
Hmm.
if you are having mild abdominal pain, which is
Hmm.
like for lasting for 1 or 2 days, it is
Hmm.
considered as normal, and we call
Okay.
it as spasmodic dysmenorrhea or spasmodic pain. So what is it? Normally during menstruation there is shedding of uterine lining. So to do so, your uterine muscles contracts,
Hmm.
and it squeezes your blood vessels, and it pushes your uterine lining out of vagina.
Hmm.
Okay,
Hmm. Hmm.
so there is one hormone called prostaglandins. Prostaglandins is released by this uterine lining, which is a major cause for uterine contraction, and it also
Okay.
plays a role in pain.
Hmm.
So that is the mechanism. Secondly, there is the second kind of pain is like constrictive dysmenorrhea. So in this, you have pain before your menses start, and it continues throughout your menstruation. So
Hmm.
this kind of pain is normally associated with some kind of underlying disease. You know,
Hmm.
what happens is, for example, you can take infection of cervix or uterus, which we call pelvic inflammatory diseases, or it
Hmm.
can be due to fibroid. Fibroid is growth in the uterus, which is usually non-cancerous, or it may
Hmm.
be endometriosis. Endometriosis is a disorder in which tissue underlying the uterus tissue underlying the uterus grows outside the uterus. So
Oh.
it can be in fallopian tube or it can be in ovaries. So
Right.
all these things causes pain, and this is not normal. Mild abdominal pain is normal. Okay,
Okay.
which I
Okay.
told you that once your period starts and you have it for 1 or 2 days, that is normal. But if your pain starts before menstruation, few days before menstruation, and it continues for, like, if you're bleeding for 8 days and your pain is continuous till 8 days, then this is not normal. You have to evaluate why. So this pain, severe abdominal pain, is never normal. Understood? For like prolonged period of time, like
Okay.
someone
Yeah.
will tell you that, oh, I have pain for 10 to 12 days when I am on my periods. So that is not normal. You
Hmm.
have to evaluate why this is happening. And second question you asked, how to manage. Okay, so first thing is you can go for hot bed fermentation on your back or lower abdomen. Secondly, exercise. Mild exercises like treadmill or yoga helps you. It
during the period?
releases positive. Yes, yes, it is absolutely fine to do mild exercise during periods. You know, it
Okay.
releases positive hormones, which is
Hmm.
endorphins, and
Hmm.
it will help you in abdominal cramps. Then you can massage. Massage is one of the way. Secondly, avoid smoking during this period,
Hmm.
and avoid food which causes bloating and fluid retention, like salty food, excess amount of coffee, excess amount of tea. Then you can occasionally have painkillers like paracetamol or brufen. So these are few things, you can manage your pain during
Yeah.
menstruation.
Thank you so much. These are some practical things that we can very easily adopt.
Yes, yes, definitely.
Yeah. Thank you. And then there's one more question that says, what are the best practices for maintaining menstrual hygiene?
See, the best thing I would say is like you have to change your pads every 6 hours. If you're using whatever you're using, menstrual cup, tampons, whatever, at least 6 hourly you have to change it. First thing.
Okay.
Second thing,
Okay.
you have to keep your genital area dry and clean.
Hmm.
Third, keep your undergarments clean. Then whenever you use, wrap your sanitary pad in a paper bag and dispose it well. Then you can also, what you can do is whenever you urinate, you have to clean your genitals. Then avoid vaginal douching. Normally, we use flush,
Hmm.
so avoid that. Vaginal douching should be avoided. Then uh, if you're using menstrual cup, so you have to wash your hands before and after using menstrual cup. Third, then it is like once you remove your menstrual cup, you have to
Hmm.
flush that blood inside the toilet and then clean it properly with warm water and dry it off, that menstrual cup, because you are going to
Okay.
reuse it. You're not going to throw
Yeah,
it. Pads we
yeah. Right.
throw, but menstrual cup you are going to again use it.
Use.
So you have to
Yeah.
clean it properly with warm water and you have to dry it. So
Okay.
that's you can do.
Thank you so much. And I guess women out there are listening to this uh, because this is very basic yet very important, because we don't choose to talk more about periods, and we are very
Yes,
hesitant when we talk about our genitals, when we talk about keeping our genitals hygienic, washing our undergarments, keeping them hygienic. हम ये सारी बातें बहुत छुप छुप के करते हैं. We are not
true.
ready to talk about it openly, and that's why today we have the expert Dr. Denisha Kiklawala with us, so that ये जो छोटी छोटी चीजें हैं that we are not able to discuss, we can just get the knowledge about it, the information about it from the doctor herself, and we can adapt it in our regular routine life. So yeah, doctor, we are so glad we have you, because these are just random
It's my
things that
pleasure.
हमें शायद कभी सुनी थी, पर हमने कभी सोचा ही नहीं कि these are so important, and you are making us know it with the right words.
Thank you so much. I know because I have seen patients over here. वो मतलब उनको कुछ भी नहीं पता होता है. They don't know anything. I have to explain everything. They'll ask you such basic questions that you feel means I know means it's like कि they don't know this means कितना ज़्यादा उन लोगों का unawareness है लोगों को.
है.
That
Yeah.
I feel when patients comes to me. Means ये उनको पहले पता होना चाहिए था. It is not like why they are not knowing, but it is like कि इतने सालों से like they are like around 20, 25, 30 years they don't know this thing. They
Oh,
should have, they must be मतलब उनको ये पहले से पता होना चाहिए था ये सारी चीजें. ऐसा मुझे फील होता है कि यार क्यों पेशेंट्स इतना ये हो रहे हैं, बिकॉज आई एम इन पेरिफेरी, आई एम इन रूरल एरिया, आई नो व्हाट फीमेल्स गो थ्रू.
Go through.
They are not ready to talk, they are not ready everything, a lot of times only husband will ask, all these questions are asked by husband, she
Oh my
won't even
God.
speak a word. Yes,
Now this
she
is more
won't even speak
difficult.
a word. It is routine over here. No one will, they'll ask so many questions, but the husband will ask, she won't say a word about it.
Oh God.
It is
So
difficult.
yeah, this is the basic thing. See, for people like us who are living in cities, this is a basic information. This is kind of an information that we might be knowing, but we didn't know the right words. We didn't know how to put it
Yes,
across. But people living in the periphery, in the rural areas, to them, this topic is untouched.
definitely.
बात ही
And
नहीं करनी. Pillow talks is not talk only.
मतलब ऐसा होता है ना बहुत बार कि द फीमेल, मुझे कभी वो लगता है कि शी इज नॉट इवन अंडरस्टैंडिंग मी, मतलब मैं किस लैंग्वेज में उससे बात करूं कि वो समझे, क्योंकि बिकॉज हर
जी.
रिस्पॉन्स इज लाइक दैट कि उसको ऐसा लग रहा है कि उसको कुछ समझ में ही नहीं आ रहा है, मुझे फील होता है बहुत बार. सो आई हैव टू टॉक टू हर हस्बैंड कि भाई एटलीस्ट यू अंडरस्टैंड. शी इज नॉट अंडरस्टैंडिंग बिकॉज शी
Not
वोंट,
understanding. Yeah.
she won't answer me. She look at me like with blank faces, and I am like कि whether she's understanding what I'm trying to tell
Understanding or
her
not.
or she's not. Yes. So most of the people you have to talk to their husband only. They are like, they don't respond.
Hats off to you, ma'am. Hats off. Because I know, I- in general, also, ortho say discussing about their periods and what to say, intimacy is such a big deal. So now dealing with the people in the rural areas is a deeper topic, a deeper issue to make them understand the
Yes.
small things.
Yes, it is difficult, a lot of time, husband will come and tell me that she is not understanding about, whether I can keep relations during, when she's pregnant, or they'll ask so many things that she is not letting me, have relations. Now the thing is, how am I supposed to explain her?
Yeah, yeah.
Yeah,
So I
because
guess
she is not someone who will understand it. That is the problem, because
the
language barrier is
unawareness
also
is
another.
very profound there.
And secondly, your mixed public are more, you'll get people from UP,
Hmm.
you'll get people from West Bengal, so they don't even know
हाँ,
Hindi. मतलब UP तो it's like
बहुत
fine, but West
डिफिकल्ट है
Bengal
उनकी
women,
लैंग्वेज में.
उनको तो उनको कोई लैंग्वेज समझ में नहीं आती है. I just they
अच्छा.
just look at me with blank faces. I don't know how to deal with them, because
No, no,
मतलब वो
hats off to
हस्बैंड को
you.
भी समझ में नहीं आता है, और
Fight.
इसको भी समझ में नहीं, वाइफ को भी समझ में नहीं
I
आता
know.
है. दे डोंट नो हिंदी. उनको सिर्फ उनकी भाषा बंगाली समझ में आती है, वो मुझे
समझ
नहीं
में.
आती है.
And with that, there's
It's very
one
funny.
question from the audience. It's from Manju Singh Srivastav. She asks, "What about the mood swings before and after the periods? Can we do something with it? Something about it?"
See, you can just, go for daily exercise, go for whatever you like, gymming. I'll tell you, half of your problems will be solved. This whatever menstrual problems you are having will be solved
Hmm.
if you'll go for regular exercise, whether it's
Okay.
gymming, whether it's, at home. You can do a lot of exercises. There a lot of YouTube channels where you can, a session for like half or 45 minutes. If you do regular exercise, your mood swings, your abdominal pain, all will be reduced,
Hmm.
because
Okay.
exercise releases happy hormones. These hormones will help you during menstruation. So that is the
Thank you.
only thing you can do. And other thing is like reduce intake of caffeine and intake of tea.
Yeah. Thank you so much for answering the question. I hope, Manju, you have got your answer. And there's one more question from Sarita Shukla. She's asking on behalf of a new mother that can postpartum bleeding. be confused with periods. How do I tell the difference?
Postpartum postpartum bleeding will be once you give birth, then
Hmm,
at that time you will be having period. Okay,
hmm,
then
hmm,
it is
hmm,
like 10 to 15 days, or some female bleeds for like a month, and
hmm.
some females with like 10 to 15 days they will stop having,
Yeah.
periods. So now the thing is ki, what is the duration? Understood? Childbirth and duration of your periods is also
Hmm,
important. Now, if you'll tell me that she has given birth 2 months back and still she is having bleeding, so it can't be postpartum bleeding, right? Because postpartum bleeding is like for 15, 20, or a month, not more than that.
right.
After 2 months, 3 months, it is not postpartum bleeding. It may be because of your normal menses, but there has to be a gap. Like once your postpartum bleeding starts, 15, 20, 25, or a month, after that
Hmm,
it stops, and then again after a month you get periods. So that is normal bleeding. Understood? So that is the difference. What you have to see the duration,
hmm,
at
hmm, hmm.
what duration she is having bleeding. And normally if you are lactating
Hmm.
mother, a lot of mother don't get their periods for like 6 months or a year.
Okay.
If you
Okay.
are lactating and you are giving your baby breastfeeding
Hmm, hmm,
regularly, like every
hmm.
2 hours, 2 hourly you're
Hmm.
giving, so normally they don't get their periods for 6 months to a year.
Okay. Okay. Thank you so much for this information. We didn't know about this as mothers. I was not knowing this. So I hope Sarita Shukla ma'am has got her answer. And the next question is something that we need to discuss on this day, the menstrual hygiene day. That are there any myths? I know there are many myths. Are there any myths about periods that you would like to burst today?
uh, See, people say that you should not wash your hair during menstruation. So there
Yeah.
is no study which says that you
Hmm.
cannot wash your hairs. In fact, you are compromising your personal hygiene, first thing. And the fact is, if you take warm water bath, then it helps in your menstrual cramps. First thing.
Hmm.
Second
Hmm.
thing, they say menstrual blood is impure.
Hmm.
So, no, menstruation is a mixture of blood plus your mucus lining and your uterine tissue. All of these
Right.
flows from vagina to, flows from uterus to cervix to vagina. It is not
Hmm.
impure, it's a
Hmm.
normal
Hmm. Hmm.
phenomenon.
Hmm.
Then they say that severe abdominal pain is normal. So a lot of female feels that severe abdominal pain during menstruation is normal. No, it is not. It may be a cause of some underlying disease or
Okay.
hormonal problem in your body. So you
Hmm.
need
Hmm. Hmm.
to check it. Then people say, a lot of people say exercise during menstruation is, you cannot exercise. One cannot exercise during menstruation.
Hmm. Hmm. Hmm.
So
I
I
thought
would
the same.
say, no, it is not like that. In fact, there is no scientific study which states that if you exercise during menstruation, then it will affect your physical health. In fact, as I told you, if you exercise during menstruation, then it will reduce your abdominal cramps. It will help
Okay.
you. It will help you in your mood swings. The
Hmm.
इससे पहले क्वेश्चन पूछा गया था. सो एक्सरसाइज जो है वो हेल्प करता है. आपका जो मूड स्विंग्स है वो नहीं होते हैं अगर आप रेगुलरली एक्सरसाइज करते हो. यू विल बी हैप्पी ड्यूरिंग दिस
Okay.
पीरियड.
Thank you so much. And there's a very generic question, um, which says that at what age should parents, rather a mother, start talking to their daughters about periods?
Mm, See, the right time to talk to your daughter about period is when she first asks you about it. You know, a lot of आजकल generation ऐसे ना, they'll definitely, if you're free, they'll ask you that what is menstruation. So when she
Yes.
first asks you, you should answer her.
Hmm.
And
Hmm.
if she doesn't, then pubertal age nowadays is like 9 to 12 years. So
Okay.
definitely around 8 to 9 years will be the good age to talk to her about it. Secondly, mothers should observe, the physical and mental changes in her daughter, like a sudden growth spurt or mood swings. Then is the
Hmm.
time you should talk to her. It is not like menstruation, first menstrual cycle, means menarche. We call this as menarche,
Hmm.
first menstrual
Hmm.
cycle. So it is not like a 1 day process. First you'll see the changes in her body. Like the first thing you see is breast budding in a girl. Then there is appearance of pubic hair, and then there will be like first she'll get her first period. So it is a process. You can see the changes in her body, and then when you realize, then you can talk to her. This is the right time to talk to her when you see these changes.
Hmm. Hmm.
And
Hmm.
I would definitely say that it is never too early to sensitize your child about periods. So you have to
Absolutely.
talk to her. You have to talk to her openly, and it is like, I would say 8 to 9 years is a perfect age to talk to her. And if she asks you before that, then you should talk to her about it. Means if she is asking you this question, then she is mature enough to understand it.
Understand. So true. Yeah.
So that is the thing.
Thank you so much. This answer is so appropriate. Thanks a lot.
Right.
And yet another question, uh, because we are coming to the end of our questions and end of this session, which I am not liking, which the audience is not liking. But yes, there's a word of advice that you would like to give as a gynecologist to the young girls starting their periods.
See, I would say to young girls, I would say that menstruation is a natural and healthy phenomenon of your body. It is
Hmm.
it is not something you should be ashamed of. You should accept it. One thing.
Right?
Secondly, I would like to tell parents that please communicate openly with your child about her puberty, about her periods, and about the body changes she is going through.
Going.
Then you should prepare her for all the discomfort she'll have, pain she'll have during periods. And second and thirdly, you should encourage them to eat healthy, to exercise regularly, to have good amount of sleep. So this is what you can do. Menstruation में जितना एक लड़की, because she is small nowadays, you are getting periods like from 9, 10, 11. What do I expect from her? She's so small. So
So innocent. Yeah,
basically,
yeah, yeah.
yes,
Maturity
yes,
level नहीं होता है
basically
उतना.
नहीं होता है. Basically it is a duty of a parents to talk to her properly, understand her, make her understand what is period.
Yeah.
बहुत घर में ऐसा होता है कि लोग बात नहीं करते हैं, मतलब
नहीं करते हैं.
मदर्स
Yeah,
बात
yeah.
नहीं करते हैं. It is difficult for her. Her hormonal changes is she is going through hormonal changes, and no one is there to there who can share her problems. I would definitely say that बच्ची से ज्यादा important ना mother का है कि how she is going to treat her, how she is going to
Communicate.
make her understand what it is. बिकॉज इट इज नॉर्मल. बट हमारे टाइम पे क्या था कि हम थोड़े से बड़े हो गए, अराउंड लाइक 12,
फिर हाँ,
16,
you're
18
right,
ईयर्स
you're
में
right.
आता था.
Absolutely right.
अब नाउ बिकॉज ऑफ जंक फूड, you can say junk food, you can say जैसे टीवी, कार्टून्स, रील्स, ये सारी चीजें बच्चे देखते हैं, लैक ऑफ एक्सरसाइज, ये सारी चीजों की वजह से ना the pubertal age
होता
has
है.
decreased. It has
Correct.
decreased. Now females get the periods like 9 to 12 years. अब उतनी
Very
maturity
early.
नहीं होती है. It's very early. उतनी maturity, they don't have that maturity to understand what is
Hmm.
going through
Hmm.
her
Hmm.
body. So it is the duty of a mother to make her understand that it is normal, it is natural, and you shouldn't be ashamed of it.
True. Yeah, right. And we have one more question from the audience, doctor. The question is from Archana Patil. Some have severe pain during ovulation. What must be the reason?
Sorry, some has.
Some have severe pain during ovulation. What must be the
Okay.
reason?
See, during ovulation, there is rupture of egg. You know, ovulation causes rupture of egg. So
Hmm.
that can be one of the reason. But you have to, if you are having severe pain during ovulation, you have to seek medical help. Just go and check, do your sonography. There are a lot of things like PCOD is there. You
Okay,
must have
doctor,
heard
just
PCOD is there.
one minute before you complete your answer. The question that Archana ma'am has asked, she's continued one more line to it. She's saying that I, being a mother to a special needs child, what should be the easy way to explain this
To a special need child. About menstruation,
about the pain during ovulation?
about the pain during ovulation. See, that is what I'm trying to say. She needs to, first of all, she needs to check how old is she is. Your baby means maybe she's like 12, 13, 14, 15, I don't know. So if she is more than 15 years old, then first and foremost thing she needs to do is, she has to go and see a doctor, whether she is do her sonography, and in sonography whether everything is normal or not. She has to check
Hmm.
about it, because there are a lot of the egg PCOD is there, which is the quantity of egg in PCOD is more, but the quality is not good in that. So PCOD patient will have, special needs children have
Hmm.
tendency of PCOD.
Okay.
So
Okay.
it will increase her weight. It will, she'll have pain. She'll have irregular periods. Like every 2 to 3 months, she will be having her periods. So she has to, first and foremost, she has to do is go and consult a gynecologist, because we'll have to see if she is having severe pain during ovulation, then
Hmm.
it is not normal. It is not normal.
Right.
So we
Yeah.
have to look into it, that what is the cause. That this is what I told you, that severe pain during menstruation or ovulation is never
Hmm.
normal. Mild
Okay.
abdominal pain, which you can bear, means, what I'll say, that the pain is so severe that you are not able to get up from your bed, you are not able to do your daily routine, is not normal. It is something you should take care of.
Hmm.
Now it depends how her, daughter's pain is. I don't know whether she's
Hmm.
having such a severe pain that she's not even able to get up. Then it is not
Hmm.
normal. She needs to seek a doctor. She needs to consult a doctor for that.
Okay, she's asking for a girl who's 12 years old.
She just started her periods. 12 years old girl she's talking about.
Yeah.
Okay, but is she having regular periods? Whether she's having regular periods, whether she is, and secondly, 12 years old now, what happens is your hormonal excess is getting prepared. Understood?
Okay.
That time your periods are not regular. A lot of females will complain that during this period, pubertal, this is a pubertal period. A lot of
Hmm.
females will complain that she is having delayed periods, or once a period comes, it doesn't stop, or she's having frequent menstruation like every 10 to 15 days. It happens because her, hormonal excess is getting prepared. So
Okay.
there can be, pain, there can be delayed periods, and it is normal. Delayed periods is normal, but frequent menstruation, and if she is having, uh, if once a period comes and it doesn't stop, then this is not normal. Then she has to go to doctor
You
and
have to see a
visit the
doctor.
doctor. Yes.
Thank you so much, doctor. First of all, thank you for answering all the questions from the audience so patiently. And thank you for, on behalf of Team Story Scrapers for giving your time to us, because we know you have a jam-packed schedule. And amidst
No,
of
no,
that,
thank you so
answering all
much.
our questions so patiently and so rightly, so appropriately means a lot to us. Thanks a lot.
Thank you.
You
Thank you
you
so
made
much.
you
Thank you
you
so
made
much.
our menstrual hygiene day very worthy.
Yeah, Menstrual Hygiene Day, why do we celebrate it on 28th May? Because normally a female, generally a female bleeds for like every 28 days she has her cycle and she bleeds for 5
Oh,
days.
okay,
That's why we
okay. We
celebrate
didn't know
menstrual.
this. Thanks a lot. This is what to say, a genius information for all of us. Thanks a lot, Dr. Danisha.
Thank you. Thank
And
you so
I
much.
am
Thank you for having
personally
me
going
here.
to share this live session with as many women as I know, because they need to know this. And dear audience, you do the same. If you are a man watching this video, kindly share it with your sister, your wife, your girlfriends, and people you know who need to know this. So thanks a
Thank
lot,
you.
dear
Thank
audience.
you so
Thank you for
much.
joining.
Thank you so much. Thank you so
And
much.
thank you
It's
so
a
much
pleasure
once
talking to
again.
you. Thank you.
Thanks a lot, Dr. Denisha. Thank you, dear
Thank you.
audience. And those who have not yet started writing and reading and attending the live sessions for Story Scrapers, please like us, follow us, subscribe us on Instagram, Facebook, and YouTube. Thanks a lot. A good evening to all of
Thank you.
you. Bye bye. Thank you, Doctor. Hope to see
Thank
you
you.
soon.
Thank you. Same here.